So you wake up with a stiff neck, or maybe you just rolled your ankle on a weekend run. You're standing there, staring blankly into your freezer, weighing a bag of rock-hard frozen peas against your trusty heating pad. It's the ultimate recovery dilemma, right? We've all been there. It sounds incredibly simple, but getting this wrong can actually delay your healing and make the pain worse. In this explainer, we're breaking down the exact science of temperature therapy so you never have to second-guess your physical recovery again.
Picture this. You just tweaked your knee walking down the stairs. Be totally honest with yourself. Do you reach for ice or do you reach for heat? If you're kind of scratching your head right now, you are far from alone. Most of us are just relying on pure guesswork or, some old wives' tale we heard decades ago. But our bodies are highly complex machines. Applying the wrong temperature at the wrong time can actually send the exact opposite signals to your circulatory system than what it actually needs to heal.
Okay, let's dive into this using a really brilliant metaphor from the experts over at Johns Hopkins Medicine. I absolutely love this. Think of ice and heat as the brakes and the gas pedal for your body's healing response. Ice, that acts as the brakes. It physically constricts your blood vessels and numbs that sharp pain. Heat, on the flip side, acts as the gas pedal. It expands those blood vessels and relaxes tight muscles. Grasping this whole gas and brakes dynamic is literally the master key to unlocking rapid recovery.
All right, let's start with team ice, the inflammation fighter. When an acute trauma happens, say you trip, fall, or sprain a joint, your body instantly rushes fluid to the area. It creates this massive, localized traffic jam of swelling. And in that exact split second, you need to hit the brakes.
And that brings us right to the official guidance from the American Academy of Orthopedic Surgeons. For responding to a sudden trauma, like your classic ankle sprain, they recommend the essential 4-step protocol pretty much everyone knows as the RICE method. Rest, ice, compress, elevate. Notice how step 2 is ice. Why? Because you are actively trying to minimize that initial wave of traumatic swelling. If you applied heat right then, you'd actually pump more fluid into a joint that is already swollen to the max, which is, for sure, the absolute last thing you want to do.
So the big takeaway here is that ice physically reduces the blood flow to the injured area. By rapidly narrowing those local blood vessels, cold therapy is effectively stopping swelling right in its tracks. Plus, it's actively dulling the local nerve endings, giving you that immediate soothing, numbing sensation to combat the sharp pain. You hit the brakes, you stop the swelling, and boom, you gain control of the injury.
Now let's shift gears over to team heat, the muscle relaxer. If ice is the brakes, heat is absolutely the gas pedal. Once the initial swelling of an injury is totally subsided, which is usually after a few days, you actually want to aggressively encourage blood flow to help the tissue repair itself.
Think about having a rock-hard lower back after hunching over a desk all day, or stiff shoulders from lugging around a heavy bag. In these situations of chronic tension and stiffness, your muscles are totally locked up. They are basically starved for oxygen. Warmth is absolutely the correct choice here. The heat opens up the blood vessels, hitting the gas pedal to drive fresh oxygen and nutrient-rich blood right back into those tight, aching muscle fibers. It finally allows them to relax and stretch out.
But just when you think you've got all the rules figured out, we arrive at the heating pad plot twist. Yeah, there is a surprising, lesser-known danger to overusing that super comfortable heating pad you probably love to curl up with on the couch.
Enter a really fascinating and honestly slightly alarming medical oddity documented by the Cleveland Clinic. It's called erythema ab igne, or as it's more commonly known, toasted skin syndrome. It is a web-like hyperpigmented skin rash caused by prolonged, repeated exposure to low-grade heat therapy. It literally alters the elastic fibers and microscopic blood vessels in your skin. I know, it sounds like pure science fiction, but dermatologists are seeing this more and more in modern patients.
And what's crazy is this isn't caused by severe burns from a fire. We are talking about everyday habits. Things like resting a heating pad on your lower back for hours while working from home, or, accidentally falling asleep with a warm heat wrap draped over your shoulder. If you ignore those 15 to 20-minute recommended time limits on your heat therapy, it can literally leave you with a permanent web-like discoloration. Turns out, pressing the gas pedal too long can actually burn out the engine if you aren't careful.
So, how do we successfully navigate this minefield of freezing and baking our bodies? Let's open up your Safe Recovery Playbook for a rapid-fire summary.
This right here is your ultimate recovery cheat sheet, perfectly synthesizing the orthopedic and dermatological data from all of our sources. If it's an acute trauma, like a fresh sprain, grab the ice. Hit the brakes and constrict the swelling. If it's chronic tension or muscle stiffness, apply the heat. Hit the gas and expand those blood vessels. And crucially, if you're ever tempted to use prolonged heat exposure for hours on end, the answer is neither. Just stop, unless you want to risk toasted skin syndrome.
You've got to keep those therapy sessions to a maximum of 20 minutes, and always use a cloth barrier between the temperature source and your skin.
We've covered the cellular science, the official orthopedic protocols, and the hidden dermatological dangers of temperature therapy. So, I'm going to leave you with this. The next time pain strikes, will you be treating this symptom effectively or accidentally making it worse? Remember the gas and the brakes. Use this knowledge to empower your recovery, heal faster, and treat your body right. Thanks for joining me on this explainer, and keep learning.